In the Philippines, more than 50% of adults are smokers. Out of these, 72 to 73% are men. Female smoking is more common than in any other Asian country. 60.6% of current cigarette smokers stated they are interested in quitting. Less than 6 million people die from tobacco use and exposure to tobacco smoke. One death occurs every 6 seconds. There are approximately 600 ingredients in cigarettes. When burned, they create more than 4,000 chemicals. At least 50 of these chemicals are known to cause cancer, and many are poisonous. Smoking is a hard habit to break because tobacco contains nicotine, which is highly addictive. Smoking has numerous immediate and long-term effects on the brain, the respiratory, cardiovascular, immune, and the metabolic systems. Let us talk about the physiological effects or changes in our body associated with smoking.
Nicotine from smoking tobacco is absorbed through the lungs and reaches the brain in approximately 10 seconds. Moreover, nicotine blocks other neurotransmitters, resulting to the desensitization of the nicotinic receptors.
Nicotine induces an increased release of norepinephrine and epinephrine. Norepinephrine directly stimulates the vasomotor centers in the medulla, which regulates blood pressure and vasoconstriction or vasodilation. Meanwhile, epinephrine indirectly affects the CNS, which results in an increase in blood pressure, respiration, and heart rate. Finally, nicotine binding causes an increased release of dopamine, a neurotransmitter that gives feelings of pleasure and calmness. In between smoking cigarettes, dopamine levels decreased, leading to withdrawal symptoms of irritability and stress. Also, nicotine binds competitively to acetylcholine receptors, causing prolonged activation, desensitization, and upregulation of receptors. After smoking, nicotine levels decrease and receptors revert to an open state, causing hyperexcitability, leading to cravings, thus an increased risk of addiction. It has been shown that smoking causes the body's vessels to constrict. Nicotine increases the endothelin-1, which causes constriction of blood vessels. Nicotine also triggers the release of epinephrine into the bloodstream, which causes the vasoconstriction, the increased blood pressure, and the increased heart rate. Nicotine increases the resting heart rate as soon as 30 minutes after puffing, and the higher the nicotine consumption, the greater the heart rate. The increased heart rate increases the cardiac output, thus increasing the mean arterial pressure. This, along with the increase in vasoconstriction, which increases total peripheral resistance, are the factors that contribute to the increase in mean arterial pressure. Smokers have elevated levels of thrombin, an enzyme that causes the blood to clot after fasting, as well as a spike immediately after smoking, and fibrinogen, the precursor for fibrin, a factor for thrombus formation. Smoking may also lead to thrombosis, which is a process that results in the formation of a clot inside the blood vessel. This process may result in blockage of blood vessels, stopping blood flow to vital organs. In addition, thrombosis especially occurs around sites of plaque formation. Such narrowing can impair blood flow to the heart, brain, and other organs, causing them to fail. The nicotine from cigarette smoking induces oxidative stress on erythrocytes. Cigarettes also contain carbon monoxide, which competes with oxygen in hemoglobin binding. Carbon monoxide binds to the heme group of the hemoglobin molecule at the same site as oxygen and forms carboxyhemoglobin. The affinity of carbon monoxide for hemoglobin is 200 times greater than it is for oxygen. In the presence of carbon monoxide, the affinity of hemoglobin for oxygen is enhanced, which causes a shift to the left of the oxyhemoglobin dissociation curve. This prevents the unloading and delivery of oxygen to tissues. As a result, the bone marrow releases more red blood cells to compensate for the decreased amount of oxygen received by the tissues. Higher levels of white blood cells, red blood cells, hemoglobin, and hematocrit are also evident in smokers. Tobacco smoking has effects on the passages from the nose and sinuses down to the smallest airways of the lungs. These effects can be immediate and long-term. One is bronchospasm and wheezing. The lungs produce mucus to trap inhaled foreign bodies, and the cilia in the airways help propel these substances out through coughing. However, chemicals in the tobacco smoke paralyze the cilia and increase production of mucus, thereby leading to accumulation of phlegm. Also, the chemicals inhaled in smoking irritate the lining of the bronchi, causing inflammation and possibly infection. Bronchospasm and increased phlegm increased airway resistance, resulting in airway obstruction.
Health benefits of quitting. Tobacco smoke contains a deadly mix of more than 7,000 chemicals. Hundreds are toxic, and about 70 can cause cancer. Tobacco smoking increases the risk for serious health problems, numerous diseases, and death. People who stop smoking greatly reduce their risk for disease and premature death. Although the health benefits are greater for people who stop at earlier ages, quitting is beneficial at all ages. Stopping smoking is associated with the following health benefits: lowered risk for lung cancer and many other types of cancer, reduced risk for coronary heart disease, stroke, and peripheral vascular disease, reduced coronary heart disease risk within 1 to 2 years of quitting, reduced respiratory symptoms such as coughing, wheezing, and shortness of breath. The rate of decline in lung function is slower among people who quit smoking than among those who continue to smoke. Reduced risk of developing chronic obstructive pulmonary disease, one of the leading causes of death. Reduced risk for infertility in women of reproductive age. Women who stop smoking during pregnancy also reduce their risk of having a low birth weight baby.
In summary, smoking causes numerous harmful effects in the body aside from the ones discussed. It would be best to quit smoking as soon as possible, or better yet, do not attempt to try it at all.